Hi, my name is Brian Curtin with the OrthoCarolina Hip and Knee Center, and I'm going to be discussing risks associated with hip and knee replacement. We know there's numerous risks associated with any surgery, particularly hip and knee replacement, but they are far and few between. The one that we worry about the most is probably infection, simply because it has quite a devastating effect. It typically requires additional surgery, as well as IV antibiotics, and typically worse outcomes. We also worry about DVT or blood clot and pulmonary embolism. We treat these with blood thinners, typically post-operatively, to try and reduce that risk of those occurring. We also worry about implant failure over time. Implants have gotten a lot better over the past few years, and I think it's becoming less and less of an issue, but there's always potential for the implants to fail with time, which would require additional surgery. We also worry about, with any surgery, heart attack, stroke, and death. Ridiculously small risks, but they are still risks. Particular to hip replacement, we worry about dislocation of the hip, meaning the hip can come out of socket, which typically requires additional surgery to repair that. Also, a problem with hip replacement is also leg length discrepancy, meaning one leg's just a little longer than the other, and often is the case when you're trying to make sure the hip is stable. We typically try and treat that with just a simple shoe insert, which often equilibrates the leg lengths. Again, there's risks associated with any surgery, particularly hip and knee replacement, but most patients do quite well without any additional complications.